Hi, and welcome to Leadership in Healthcare Systems for the Nursing Professional. Each week I'll make a very brief video just reviewing the competencies and outcomes for the week and the topic of the week, and probably posing a couple of questions along the way as well. I want you to be sure to remember that in your assignments to reference the student learning outcomes as you go along in competencies. So week one has to do with human behavior and organizational structure. The student competency is to apply theories and concepts of human behavior in the analysis of the organizational system or culture. The student will explore the influence of gender and how a person may view power. One thing that's quite interesting is that males still remain the minority in nursing, yet we see many males in nursing supervisory positions or positions above that in management. We are to differentiate among different types of power and the resulting effects on human behavior. We are going to explain how the structure of an organization can facilitate or impede progress. And we're going to describe strategies the leader and or manager may use to develop an optimal organizational culture. So think for a little while about these kind of questions. Are you aware of the current organizational structure of your facility? If you were to be given an organizational chart, could you figure out what names went where and who went where? Do any of you sit on any councils or committees at your facilities? Many facilities have unit-based councils, and then they have nursing-based councils that cover all of nursing. So it might be a med-surg practice council. It might be an overall practice council. Maybe you have ethics committees that you sit on. Maybe you've been on some special councils or committees to solve a certain problem. Do you feel that your voice is heard as a result of membership on this council or committee? Do you feel that what you have to say at the table actually gets brought up to nursing management and higher? And going along with that question, do you think that your council or committee has any power, any real power to change things? Also, whether you're a staff nurse or a nursing manager or a nursing supervisor or you run an office, how empowered do you feel on a daily basis at work? How empowered do you feel about the decisions that you can make on a daily basis at work? And then finally, what patient care delivery model is used at your facility? The chapter that we read, chapter 14 on organizing patient care, talked about a lot of different patient care models. Can you see one that you have, or is it a mix of some? And do you think that's effective? Which model do you think would be the most effective in your practice? And whatever one you think would be most effective, do you think it would actually be feasible in your practice area? So just a couple questions to ponder. I will see you online. I will be an active part in the discussions. And I also want you to feel free to email me either through Canvas or through the BayPath email anytime that you have a question or want to talk about something. If you actually want to talk via phone, please email me to set up a time, because many times I'm not able to pick up my phone when somebody calls if I'm at work or I'm teaching a class or something like that. So take care, ladies. I will see you online.